Lisa talked about her passion for innovation, and she's not just talk, she actually puts her money where her mouth is. She engaged with Schlesinger, and together she took a chance on a new technology, engaging in a couple of pilots to assess the possibilities. Rob has a unique perspective, having been on the client side with Pfizer and Merck, having been on the consulting and supplier side with Ipsos, and now Senior VP at Schlesinger, and much more experience, too long to enumerate, so I'm going to let the two of them tell us about their experience with the new technology.
Great, thank you for that, Karen. So I'm Lisa. I'm here in the role of the client who was willing to try to do something different. Rob came to our team, and actually they had some open houses late last year. And the team came back with a lot of ideas around, hey, here are some of the things that maybe we could do with this. Let's give it a try. And the great thing about the team at Schlesinger is they were willing to pilot with us in a very cost-effective way and try some different things. We're only going to talk about one of those today. But I have to ask you, do you have the slide advancer with you?
No, I asked for it.
Okay, because that's going to be a little tricky.
Maybe from the back room we could advance the slide while we find it.
We're going to talk about technology, and we don't even have a clicker. Do you want me to hop down there and push the button? If you like, I can go down and be the button pusher. I push lots of people's buttons. Thanks, Paul.
Sorry about that. That's all right. Yeah.
Don't you just love that great build-up? And see, if this was a wall, I could just touch it.
Exactly.
All right, so we'll get to the next slide, and I'll have to ask you this question. Have you ever been here? Have you ever been the moderator sitting in the room going, oh my God, I've got to do 36 more of these in how many cities? And you can tell that the subjects that you're interviewing are like, all right, how much longer is this, and do I get paid if I leave early? But there's also some stuff going on in the back room. Maybe you've been here, where you're the client sitting in the back. You can't see what they're looking at. Everybody's multitasking. I'm actually surprised that there aren't more devices, or maybe they're not hearing what they want to hear. They're thinking about their lunch orders. But the question I have to ask is, how can we expect consumers or physicians, whoever our customer is, to be engaged if we're not? And how can we expect to get deep emotional insights if they're already 90% gone? And that's one of the places where we saw an opportunity with the wall.
Thanks. And I'm going to spend the next couple of minutes, we're talking about the wall. Lisa made reference to the wall, but it's kind of difficult to talk about the wall without kind of showing you a video. So I'm going to ask them in the back room to start the video. It's about 2 minutes. I'm going to kind of voice it over. We actually have a mini version of
the son of the wall.
That's not the wall. We actually have a mini version with us today, but the wall for us is actually, by physical size, it's almost about the size of the screen behind me. It's 5 feet by 15 feet, 15 feet wide by 5 feet tall. Obviously, it would be kind of silly the other way around. But it's a collaboration wall. If you walk by our booth outside, you might just walk by and say, hey, that looks like a really fancy TV. What we're talking about is a piece of technology that we really see changing the way that two things are done in the future. One is in terms of the way that qualitative research, and maybe even some quantitative research, if folks are, and we can do some demos out there for you and ideas that we have in terms of how you might do trade-off sort of exercises. But it's really an interactive wall that allows you to, the respondents to engage in a different manner. You can see some of the things that are going on behind me, may look like a big giant iPad. In a couple seconds, you'll see some of the demos going on in terms of the way that the research does. And once we finish showing the video, to just make sure that you have an idea, exactly what it is that we're talking about. We'll walk you through a case study to really kind of bring it to life of how we've done it. We've done dozens of projects now. We can do dozens of case studies. So we'd be happy to tell you about a lot of the use cases. As you can see, myself, which is kind of odd, doing this right here. You can see this as being research stimuli for respondents in a qualitative session. You may say these are things that maybe typically as a moderator or as an insight company you're doing with paper. You know, they're down on the table in front of you. As Lisa said, we've both been in the back room before going, is that product X, product A, what concept is that? Is that alternative 1, 2? You know, forget about it, I'm not even gonna get engaged in research. So there's really the innovation and the data, rather the technology, what it allows us to do is it creates more respondent engagement. And at the end, we'll actually play you like a quick little 30-second video from, you know, both a moderator that participated in some research and also a respondent that we were able to come back and, you know, get their thoughts. So really when you think about, you know, your moderator's more engaged, your respondents are more engaged in research, and your clients are actually more engaged in research. You know, it creates for, you know, a much more engaging experience. But then in addition to, you know, some of the demos you're seeing behind me that are ending in just a moment, once again, there's Yankees, Red Sox. It seems like it's in a lot of presentations today. You'll see me circling Yankees and crossing out Red Sox. But what you have in addition to being a new way to show research stimuli for respondents, you know, one of the other great benefits is really, you know, it is the collaboration wall. It's really being able to, you know, bring synthesis to order, to be able to debrief, and that's the way a lot of our pilot clients are utilizing the technology, is, you know, how is a way to do better storytelling. You know, we're not going to get into that in much depth today, but we invite you to stop by and talk to us in terms of, you know, how we can utilize the technology to really enhance your storytelling. I know that that's another, you know, $10,000 question that's out there, you know, for the future. Really, I have a big stopwatch in front of me, so I'll keep going forward fast. You know, we talked about enhanced storytelling. We talked about engagement a bunch. It allows complex stimuli. So if you let your mind, if you kind of see the wall and you say, well, you know, I'm going to have a difficult time, how I'm going to present, you know, complex stimuli, or even bring stimuli in real time. You know, how many times have you been doing something like, oh gosh, like, you know, I have my creative folks in the back room, I want to be able to get that in. There's no way I'm going to get it down to the printer, back out. You know, the wall actually allows you to bring, you know, real time in. Data visualization, you know, deeper insights, faster reporting and insights. If anybody here is a moderator or is responsible for, you know, reporting, you know, a lot of what you saw on the wall behind me, you know, can actually be taken as snapshots, you know, of the work sessions. You know, even a component of the work session or the entire group, you know, to be brought into your reporting, you know, and if you develop it over time, or even if you're collaborating with a group over time, you're able to tell a better story about not just like what the end results are, you know, but what were the working components along the process that actually led to the decision or recommendation that we're presenting. So that's really been a powerful thing that there's a large pharma company that utilizes this technology en masse, has really brought to us and taught us a lot about how to use that. So I'll turn it over to Lisa for the next couple of slides to really talk about one of the pilots that we've done with Merck in the recent past.
Yes. So it's great. I see presentations like this all the time and go, yeah, you look at all the icons and you're like, well, the last 12 guys who came in here said that. So it probably helps to say, you know what, we actually have done a couple of projects, and we could have taken this from about 20 different angles. The one we chose for this particular case example in our 15 minutes is around that idea of engagement, because that was one of the first most obvious things that we saw as a real benefit coming out of this. But we were doing some patient journey work, all the rage now, on a particular condition that's really not high involvement. So the individuals who suffer from this condition, we really wanted to understand both their rational and emotional needs. And we needed them to engage with something that is 51st on their list of things that they have to do today in terms of managing their lives. So we combined a couple techniques. I was just looking around the room to see if our other partner in this is here, that helped with some of the emotion, but then we brought the wall in instead, and we can move forward as a way to present the stimuli. So some of our typical challenges, and we talked about these. The moderator's under pressure. I've got to get this group in, and then I've got to get to the next group. And later this afternoon, I'm doing another interview on cereal, and maybe that'll be more interesting. The clients, I've seen this guy. I know I have. There are some of these. They're online. They're doing their email. They're probably eating. They might be talking on the phone. But they're doing a lot of other things other than listening. And part of that is, even though there's some really great technology where we can see multi-screens, it's really hard to follow, especially after the 5th or 40th interview. And so there was a new solution that we put together, and Rob, you were pretty close to this with the team.
Yeah, so we did this in a classic, so it's not like you have to go and change your research methodologies. It's actually just incorporating technology to be more innovative. The methodology included in-depth interviews, but the use of the interactive wall. So this is something that if you're going to do emotional mining and really going after patient journey work, you can do this in a classic sort of setting. But our real beta test in this scenario was, could we get deeper insights? Because everybody's always talking about, how do we get deeper insights? I'm a big believer, as we've heard a lot today, about, going longitudinally with folks to get deeper insights. But oftentimes, we really need to rely upon, our classic research in facility. So I think that, we can get folks engaged a little bit more and get deeper insights through, techniques like, homework exercises, which brings a little bit of the longitudinal component. But really, how can we incorporate technology to be innovative? And that's where, the use of the interactive wall, really drove animated discussions. So we were, what we really did is talk about, and I'll turn the slide back over to you to present the results.
That's quite all right. He's on a roll here. But the idea was, instead of these folks sitting around the table and talking and answering the questions, they started with a discussion, but then they had to get up and interact with stimuli on the wall. And that wall is this size. So you have all of these, in this case, ladies who were up and they're moving and they're interacting with the content, and they were actually going through an emotional exercise, and they were having fun. And in the process of having fun, they start talking and they start opening up. And we talked this morning about keep it simple, keep it fun, help people get engaged with it and see the benefit. And in doing that, the insights got richer. And it was also fun for the folks in the back room. They were engaged, they were having active discussions like, did you see what that person did? And isn't that cool? And so we saw a lot more animation, and and the results were immediately available to us through the screenshots, which is great too. So this is one example.
So what we want to do real quick, because I realize I have about 4 minutes and 11 seconds left, I'm going to ask the AVUCs to...
I think you should talk faster and put more words into the
Yeah, exactly.
spaces.
We actually have a couple of videos. They're about 30 seconds each, and then we'll open it up to really some Q&A, because we do have, as I said, a dozen different case scenarios of how we can utilize this. We just wanted to show you quickly from the moderator perspective. So if we have moderators in the room that might say, how difficult is this to come up to speed? We're talking about technology. I wasn't born like in the 80s or 90s. I really want to. So we have a video from the moderator from this particular or from another
one of our
other Merck projects. And we could just hit play on this one, just explaining about.
Once moderators like myself understand the huge opportunity that's available to us with this technology, there's no reason not to use it, and we can certainly, I think, enhance the research experience by using the wall, both for respondents, moderators. What did I do? I think I was in your office for 14 hours, 15 IDIs we did on one day, and I was excited doing the last one and engaged doing the last one as I was when we started the day, just because every time somebody came into the room and was excited about using it, I knew we were going to get great responses.
And she was scared. When we went in there at the beginning of the day, and Rob and Jade are talking her through how to use the wall, she's like, oh my God, how am I going to do this and moderate? And by the second one, she's like, I got this, and this is fun, and we were seeing the folks getting up.
Yeah, thanks. Somehow they got cut off. I think that the ease of use, and then if you didn't hear, the volume was a little bit low. She did 15 IDIs in a day. I don't think we should put that on any moderator.
Can you say demanding client on the timeline?
I mean, I was a former moderator, and I wanted to put a gun to my head after 8, let alone 15, a lot. But you heard she wasn't paid for this. She really was engaged. I wouldn't do that to her every day. But then if you just want to hear quickly from a respondent, from their perspective, just to kind of bring it home, if we could hit play. This is an actual respondent.
Hi, my name's Aileen. I participated in a focus group back in December for a Spanish English health website, and what set this focus group apart from any other groups that I participated in was that there was an interactive wall that made the time fly right by. It was great to interact with this. It was unique, it was different. When I couldn't convey things with words, I would just use the wall to help me articulate what it was that I was trying to say. So all in all, I think it was a unique and great experience, and I had a lot of fun.
Yeah, I think that the key point of what Aileen was, talking there, and Lisa had mentioned it earlier, is, how can we go deeper with the insights? I think, I kind of equate it to, you become friendlier with a group of folks a little bit quicker. You become engaged. You look at folks, groups that go outside and smoke together. Somehow there's like a little bit more that comes out just because of that group dynamic that's been studied over time. Not that I'm suggesting we smoke in our facilities, but it really is just it really creates that kind of friendly dynamic where you've heard a couple of folks, you've heard Lisa talk about it. Once you get people to open up, start talking, the tool itself actually enables folks to articulate, and as we've done some imagery type of exercises, allows them so we can get deeper insights and mining with respondents. We've used this with both healthcare professionals and consumer respondents, other sectors as well, and they've all really netted out in the same different place. Really a world of possibilities. We spent the majority of our time, our case study here today was really based upon research stimuli. I don't think I give fair justice to where I think a lot of the value is. We've been approached by one of our clients to actually do a year-end review with their brand. They'd like to come in and picture being able to, at a large pharmaceutical company, you've done a couple dozen research projects over the course of the year. You need to tell senior management in 10 minutes or less, basically answer the question, what have we learned about the brand over the last 12 months? Hopefully you're going to have a good elevator speech answer. They want to come in and actually open up, and that's the ability of the size and the technology. Whiteboards can open up as well and facilitate a 4-hour session by utilizing and synthesizing. I think that's the key word when you walk away. Aside from stimuli, it's really using it to collaboratively synthesize, and we can actually take snapshots and create a story. So their goal is to ultimately develop about 120-second to 5-minute video loop to show those folks in the C-suite exactly what they've learned about the brand for the year. So kind of a unique way, but the world of possibilities is really out there.
Yeah, I would say the patient journey wasn't even one of my favorite. It was just the first. And as we looked at this and tried to figure out, okay, how does this help us get better insights? Is it just a shiny new tool, or is it something that really changes the game for us? I think one of my favorite was the one where the moderator and the respondent were involved, where we were doing website optimization between an English site and a Spanish site. And it's this big, and the folks are up and they're flipping through the pages and they're circling and they're coloring and they're like, what's with this recipe? Wait, where does this go? What does this link do? And what are you thinking with all of this? But they all got up, they're interacting with it, we could see it, and we had all of those screenshots that we could overlay very, very quickly to go back to the team and say, here are the major areas that you need to modify, update, here are things you might want to borrow. And like anytime you're trying out something new, we've tried a couple different kinds of studies, and we're still in that process to say, okay, which of these are really the best fit? Where does the wall really enable us to get more out of the method than if we did it in a traditional way?
So thanks. So finally, we invite you to get hands-on. We actually have, like I said, a mini version. We couldn't bring, the 15 by 5 foot, wouldn't fit through the front door, but we do. At least we could give you some of the capabilities. We're actually set up for, after lunch, if you want to see, say you're working in a remote location and actually want to view what your team is doing on the wall. We'll be able to show you some of that technology as well. So we invite you to stop on over. I think we have approximately 46.5 seconds left for.
Quick question.
We have time for one question, it sounds like. It's a great question. So we've done a couple dozen projects now, and that typically comes up. Do we need to bake in time for them to come up, or do we need to put in additional screening criteria to make sure that we have, tech savvy sort of folks? We always advise, it wouldn't hurt to just put in a screening question to make sure somebody can at least use an iPad or an iPhone. They have a smartphone. I only know one person in my life that doesn't have a smartphone, believe it or not. That person exists, not that there's one person, but typically it's in the warm-up exercise. The moderator will go up and just say, this is how it works. We haven't had a person that's just sat back down and said. As a matter of fact, we put chairs in them. We have different room setups. We just did a group of quads last week on the screen, and we had to change the configuration of the setup because we started off with a classic table. Nobody sat down. These were 90-minute groups. They just stayed up. We gave them the opportunity to sit down. That's how engaged they are. They just wanted to do it, but no training.
Short answer is no, not really.
Thank you so much. And again.
Thanks, guys.